Are you affected with an inherited bleeding disorder or a family member who cares for someone with one? Are you motivated by the advancement of care in the bleeding disorder community and improving yours and others' quality of life? Do you feel like you're not being considered prior to plans or studies being set in place for you or your loved one's care? Do you want your voice included and heard prior to such plans or studies being designed? The National Hemophilia Foundation, NHF, is changing that through virtual advisory panels. Virtual advisory panels, VAPs, are an exciting opportunity offered to participants of NHF's community-powered registry, Community Voices in Research. So what are VAPs? They are opportunities for participants of CVR to share their opinions and experiences on specific topics with clinical trial sponsors or investigators before studies and/or new initiatives are designed. VAPs help to amplify the patient's voice. How does it work? Since projects vary, CVR finds those who may be eligible and sends them a brief survey to confirm. The participants complete the survey they receive via email for the upcoming VAP. Eligible participants are contacted with additional information and what to expect during the meeting. On the day the VAP is scheduled, there will be a virtual 2-hour meeting and you will be compensated for your time. If you are already enrolled in CVR, know that your participation is helping to improve the lives of everyone affected by a bleeding disorder. If you are not enrolled in CVR yet, enroll today and discover other resources available for you. Join the hundreds who have already enrolled to contribute their expertise and start benefiting from CVR today.